Hello, this is Christy O'Day, and today we're going to talk about effective short term international medical trips. Um, in my experience, I've been on both sides of a trip. I've been in Honduras working, accepting short term global health groups. And then for the last 10 years, I've been coordinating groups going. So, to be fair and transparent, my bias is that we can make short term global health experiences effective and we can make them work. But certainly that is a controversy in the literature. And so, hopefully, in your reading that you've done before getting to this point, you recognize that there definitely is a controversy. And hopefully, over the next 20 minutes, I can kind of help you see kind of some of the things that we've done here at UC and at Christ to make our trips really effective and ethically sustainable. So the other title for this talk is How to Avoid Being a Band-Aid Brigade. We have all seen groups that come and go to low and middle income countries. My favorite was a group that I did meet on the way to Honduras one day, and their goal was to go head down to the beaches of Roatan and pass out Band-Aids to the people. And so I'm hoping that you feel at the end of your experience that we've done a lot more than that group maybe did. So our objectives today are to kind of review what our motivations are for participating in these global health experiences. So hopefully you've already gone through that process of looking at your own motivations. Secondly, we're going to kind of review what you've already done in terms of what are the benefits and potential risks or pitfalls of short-term global health experiences. And then finally, we're going to kind of review what I think are some of the potential keys for successful trips. So first of all, you'll hear me talking both about short-term international medical trip or short-term global health experiences. And when we talk about that, we really mean any group of healthcare professionals that is traveling from a high-income country to a low-resource setting to provide some type of healthcare services. These groups provide anything from acute and chronic care to surgeries to education for in-country providers and staff. I do want to kind of take this opportunity to also talk about a couple other terms that you might hear other people talk about that we try not to use here at, on our UC Christ trips. The first group you might hear about the first term you might hear about is called Brigade. So a lot of times folks talk about going on Brigade to Guatemala or Brigade going to some other country. We try to avoid the use of that term on our trips, and the reason for that is that sometimes that term can have militaristic or colonial or imperialistic connotations that we try to avoid. And we'll talk a little bit about kind of the relationship that we would prefer to have with our partners on the ground in Guatemala. We try to also avoid the term mission trip. At the Christ UC Family Medicine Residency, we are not religiously affiliated. And while many people who do this type of work may have religious motivations, mission may have a lot of connotations for our partners on the ground in Guatemala and in other countries. And so since our goals really are not evangelization from a religious standpoint, we tend to try to avoid that term mission. So let's do the numbers. This is all based on a study that came out of Harvard in 2008, and they looked at medical groups that were traveling from the U.S. to other low-income countries. And they found that there were over 543 organizations traveling with anywhere between 2 and 20 trips per year. They use the term mission trips, and that's why I use that term here. The average cost of each trip was $50,000 back in 2008, with an expenditure in total of $250 million per year. So the point of this is that there's a lot of money that goes into short-term global health experiences, and so it really behooves us to figure out how do we do this right. So hopefully you've kind of reviewed this already, but just to make sure that you've hit the key points here, I just want to talk about what the benefits are of short-term global health experiences, both to their partners, the people traveling, as well as to the communities on the ground. First of all, for participants, this is an opportunity to encounter things that they might have not usually seen. They might see advanced stages of illnesses that they don't usually see. They might also have the opportunity to improve physical exam skills. So these are all benefits to particularly learners like students or residents who are traveling. In addition, there may be personal fulfillment and a greater awareness of world, culture, and determinants of health for participants and their community. So these are the benefits to participants and the communities where they live and what they bring back. To the communities that we visit, we bring services that are not usually available. We bring supplies and medications that are not usually available. And often we can bring education for local providers and patients. Now, there are also many pitfalls for the community. And so hopefully you came up with some of these already, but just to review some of the concerns that can come about from short-term global health experiences are, first of all, the goals of the visitor may not be aligned with the goals of the community. So the visitor may want to screen for some type of cancer where the community doesn't really care about that. That may not be their goal. Volunteers may not have the proper training to provide the services that are needed. So, for example, the community may be struggling with an outbreak of, say, dengue, and the volunteers maybe have never seen dengue and don't really know how to treat that. Nor may they understand the local health system and what the reporting would need to be related to an encounter with a patient with dengue fever. So for many issues related to visitors, short-term therapies may not address the chronic problems on the ground. So, for example, if a patient comes in with diarrhea because they're drinking water that's contaminated, the group may give them antibiotics, but that really does not address the long-term problem of unsafe water. Sometimes the groups can impose burdens on very weak local health systems. So for instance, if there's a team of 30 people coming to visit a small village and provide health services, that team might use a lot of water that perhaps the village doesn't have. The team may require a place to stay that the village may not have. The team may require transportation to and from the airport that may put a huge burden on the village. So it is important to recognize that the resources required by the visitors may be substantial and may be very difficult for the local system to provide. Um, Oftentimes, the local standard of care may be different from what teams are used to providing, and they may not know what the local standard of care is. So, for instance, they may not understand that if a patient has appendicitis or has something that is requires urgent medical attention, they may not know where to send them or how to get them there. Um, Oftentimes, visiting teams are not aware of local issues related to a dengue outbreak or what the cultural beliefs are related to health and illness, or even what the language is. So, for instance, many visitors to Guatemala may not realize that most of the patients that they see may not even speak Spanish, but may speak an indigenous language. There are concerns about visiting medical groups creating local dependency. So, for instance, a government may be less likely to put money into their local health infrastructure if they knew that there's a bunch of visiting teams coming down on a regular basis. Finally, it may be downright inappropriate. So, what might be appropriate in the ICU of Christ Hospital in downtown Cincinnati may not be appropriate in the rural mountains of Guatemala. And so, we need to make sure that our care is appropriate for the setting in which it's provided, and that there is appropriate follow up of any type of care, including treatment of chronic disease as well as any procedures that are done. So, next, I'd like to talk about a couple keys to short term international global health experiences. So, number one is preparation. That's what you're doing right now. Preparation has many steps. So, first of all, I think self reflection, which is what hopefully you've already done in terms of examining your own motivations and those of the group, is really important as a first step. Recognizing what your motivations are and then understanding what the needs of the community are and making sure that those are similar. Planning ahead is really important to make sure that the activities that you're doing address the needs of the community, and make sure that your participants are prepared just personally, that their health is protected in terms of if they need malaria prophylaxis, in case they need insect precautions, that they're ready, but that they're also prepared professionally to be able to take care of patients in a very different setting. So that means that they need to understand a bit about the culture, language, history, common health problems, and the health system. Next is solidarity. So, when we talk about solidarity, we want to make sure that the needs of the patient and the community are the same as ours and are the priority. So, a number of things that my mentor, Dr. Heck, who is the founder of Shoulder to Shoulder, would say before a trip is first, seek first to understand. So, as a traveler, as a visitor to a country, instead of saying, gosh, why do you do things this crazy way? Why don't you do them this way? This is the way we do. Try to understand exactly why the community addresses issues the way they do, and really work with your community partner in an attitude of humility and as a willingness to learn. So, as Stephen Covey says, be a light, not a judge, be a model, not a critic. So, we really want to work in solidarity with our partners on the ground, seeking to understand what their concerns, what their issues are, as opposed to criticizing or judging the way they handle things. Next is partnership. I can not imagine doing any of this work without a community partner. This is the comité, or the shoulder to shoulder committee, in Honduras that would work with all traveling teams to Santa Lucia. And they would, while they're not medical, they had a very deep understanding of the needs of the community. They knew their community well, and they were able to assist teams in providing adequate services and needed services on the ground. I believe that partnership with the community on the ground allows for a very effective needs assessment, trying to understand what it is that the community really needs. It allows you to synergize with the community and build upon their efforts. And it really improves your understanding of the knowledge of local beliefs, health system, and common health issues. So, for example, as I'm seeing patients on the ground in Guatemala, when there's a patient that needs a referral or has a problem that I'm not sure what to do about, it is so important that I have someone like Doctora Waleska to call and ask about what she would recommend for that patient. So, working in partnership with the local experts on the ground is absolute key to making these experiences work. Sustainability. So sustainability is key to this work. And as Paul Farmer says, what we need to sustain is our commitment. So our belief within the Christ Hospital UC Family Medicine Residency Program is that these experiences work best within a long-term partnership with a community and organization on the ground. Not just a one-time visit, but a long-term commitment to working with that organization and community over time. And so by having a commitment over time, you're able to learn with each trip. You're able to measure your outcomes of activities. You're able to look at activities that go right beyond just treating the medical issues, but address the social determinants of health, such as water or eco-stoves. And you're also able to work on activities that focus on prevention, like screening for hypertension or screening for cervical cancer. So one case of this is cervical cancer screening that we did with Shoulder to Shoulder in Honduras. So as you know, cervical cancer is the leading cause of death in women of childbearing age in low and middle income countries. But oftentimes, cervical cancer screening is a low priority or non-existent in these communities. Mortality is really significantly decreased with early detection or testing for HPV. So we were able to utilize short-term teams to screen large numbers of women within an appropriate infrastructure for cervical cancer. Now in Santa Lucia in Honduras, there is a infrastructure for screening set up so that women of childbearing age all have the opportunity to be screened and are screened on a regular basis. Finally, education is and should be a key to any short-term global health experience in order to make it effective. So when we talk about education, we mean, first of all, that education is important for our participants, both before, during, and after. So before they go, we talked about the importance of preparation. During a trip, we are talking about regular conferences and thinking through and making sure that we're providing appropriate care. And finally, post-trip reflection is incredibly important for team members as well. Education is also really important for the local staff. So teams might bring knowledge of uh, issues that the on the ground staff don't have. So, for instance, in Guatemala, in medical schools, mental health is not a large part of the curriculum, and so the physicians and healthcare providers get little training in mental health. Um, Many of our providers traveling from Cincinnati to Guatemala have a significant experience in mental health and can share some of their experience with them. Education is also really important for patients. So, when seeing patients, it's important to think not just about the medication that that patient might need, but what education they might need to manage their illness. So, if a patient is suffering from something like low back pain, sure, it's really important to give them some ibuprofen. They might feel better with that ibuprofen. But it's also incredibly important to be able to teach them stretching, teach them strengthening exercises, and teach them proper body mechanics so that they can improve and hopefully prevent further issues with back pain in the future. So, one case related to this are health promoter trainings. So, this is a picture from our team that went to Ecuador in 2013. During this trip, we trained over 90 health promoters in a variety of different topics that were um, identified by the health promoters themselves. They felt like they needed training in infant care, mental health, hypertension, diabetes, prenatal care, and the identification of hernias. And so we taught the health promoters how to do these things in a curriculum that was delivered by our learners. So this is just a great example of ways that short-term trips can make a long-term impact on health in the communities where we work. So finally, it's my hope that the questions that drive you, the participants, to get on the plane, and perhaps it's a question of what can I give or what can I do, will also kind of spur you to think about why these issues and why the situation is the way it is and what you can do long term. So it is our hope as well with short term trips that our participants are understanding better the systems in place that have created the situation and the disparities that we see while we're traveling, and that they are inspired to continue to work in this area in the future to develop more long-term solutions. So these are a couple of the references related to this talk. If you have any questions or would like to discuss this further with me, you are welcome to contact me at any time. Thank you for your attention.